Are you overwhelmed with the Medicare enrollment process? Shopping for a Medicare plan shouldn't be so hard, and it can be a lot easier. I'm going to walk you through a simple step by step checklist to help you get everything that you need to know in one place before you shop and compare for Medicare plans. So let's get started. First, we want to start with your doctors. Think about who your non negotiable doctors are. These are the ones that you love, that know you, that you cannot live without. Those are most important and should be the ones that you list on this list. If you have some that you could take it or leave them off. These are the ones that you cannot live without. You must have them in your life. You must have them in your life. Make sure that you write down their office address. Say your doctor's name is Mr. Brown and you're in a large city. There's probably several Mr. Browns. So if they have multiple offices, just write down the office address that's by you and make sure that that doctor is covered on your new plan. Medications. Every year, my mom would get these massive books. These are the tier one formularies. These are the tier two formularies. We cover the brand, we don't cover the generic. We cover the brand and the generic. We don't cover the brand, we cover the generic. It's maddening. And I don't know why it's so hard, but it is. Here, you want to write down medications that you rely on a daily basis, and then maybe ones that you don't have to take as often, but if you get sick, if you have an episode, you cannot live without them. For my mom, she had COPD, and every time she got bad, she would have to go on prednisone. She hated it because it made her blow up like a balloon and gain a bunch of weight, but it got her to health the quickest. So on her list would be her daily inhalers that she had to take because she had COPD. So that's all the lungs. And then she would also make sure that prednisone was covered. And she liked the brand name. She didn't like the generics. So that was on her list too. So write down medications like that, the ones that you rely on for your daily maintenance, and then ones that you know you need if you get sick or you've used in the past, just in case you know they'll be covered. Now, hospitals are not just the hospitals that are closest to you. Some of your non negotiable doctors may only be able to practice at certain hospitals. So, heaven forbid something happens and you have to go to a hospital. Well, if you have a heart condition, you want to make sure that your thoracic surgeon or your cardio doctor can actually go to that hospital. So, hospitals are important to know for your doctors that will provide care if there's a life threatening emergency. Now, a little side note on hospitals, if you are having something like a major life event, a heart attack, something scary like that, the ambulance will take you to the closest hospital, which may not be your preferred hospital. At that point, it's about saving your life, not seeing your doctor. So just keep in mind that this is the preferred hospital list that you want to make sure that your insurance plan covers, but it may not be the one you're sent to an emergency. That's okay because you just want to be alive. Pharmacy. You don't really need the address for this because typically plans will cover CVS or Walgreens or Rite Aid. They won't say we cover this CVS, but we don't cover the CVS that's 2 miles up the road. So as long as you know what pharmacy is a preferred pharmacy, and you may have special alternatives. Sometimes there's compound pharmacies or small, just mom and pop pharmacies that you would rather go to. That's fine. Add it to your list. Preferred benefits would be benefits that are essential to your best care possible. These may be tests or screenings, or maybe you have gingivitis, so you have to get your teeth cleaned every 3 months. Things like that that will allow you to have your best health possible, and those benefits matter to you. Additional benefits are super cool perks or bonuses that are coming out in some of these plans. What we're starting to see finally is a shift to preventative care. And preventative care could be exercising at the gym. My mom loved going to the Y because it was hard for her to walk on a treadmill and things like that, but she felt like she could swim and she could actually move freely without the restriction of being able to breathe or not being able to breathe. So these could be benefits that you think will help you maintain your physical well-being and vitality in your life. Sky's the limit. There's super cool benefits that are coming out. There are many Medicare Advantage plans that have a zero cost. There are some plans that cover yoga and cover swimming and cover gym memberships. And there are even plans that will have door to door delivery for your medications, which seemed like a super special thing and now has become really common. So write down the things that would almost be like your dream benefits in this additional benefits section. Now, there's a couple other things I want you to think of. If you had a change in your health in 2020, there may be some things coming up that you need to care for in 2021. Maybe they're screenings, maybe they're tests, maybe they're surgeries. Also, think about if you've had any type of hip replacement, knee replacement, if you've had anything done with any of your arteries, some of those surgeries kind of have an expiration date and you might need to have them checked out again and plan for them in 2021. So think of those things that are coming up that you might need to take care of in 2021. Because of that, your health care needs may have changed. The plan that worked for you this year may not work for you next year, and that's okay. You can probably find a way better plan at a cheaper price. So think of things like that: screenings, tests, procedures, surgeries that you might have done in 2021. Also, do you have any health goals that you'd like your provider to help you achieve? There are nutrition programs, there are personal trainers, there's all these super cool things that many of us don't even know because we don't shop for a plan. If you have all this in one place, it takes the frustration out of it and it's not so overwhelming. And now you can actually see and compare what options you have. If there's any specific questions you want to ask about a particular insurance company or about a particular plan, with the internet, you can see reviews, you can see people's feedback. Some are valid, some are bogus. So, whatever questions are important to you to get an understanding of. And one thing I'd like to finish with is if you are calling an insurance company directly, say you're calling United Healthcare or AARP, it's through United Healthcare, and you're calling them, their goal is to fit you into one of their plans. And they may have a perfect plan for you, but they may not. So I really, really implore you to explore a company that will give you multiple quotes from multiple providers. Then you can compare, this is the plan from United Healthcare, this is the plan from Blue Cross Blue Shield, this is the plan from Humana. Which one do I like? They have to provide the same coverage by law for Medicare Part A, Part B, but they all have different things trying to make the best plan. So look at multiple providers and multiple plans. And keep in mind, if you're calling the insurance company directly, their job is to fit you into one of their plans. If you're calling someone like a broker that has many carriers, many plans, their job is to find the best plan for you, regardless of the carrier, regardless of the plan. So do yourself a service and compare. Only 13% of people shop for a Medicare plan every year, and millions of people overpay. And there's absolutely no reason. I know it hasn't been fun in the past, and it's kind of like your cable bill. Do we love our cable company? Not really. Do we feel like spending the day in the cable store? No. And I get it. But this is not your cable. This is your health. And it's important to get all of this organized in one place so you can shop for the best plan for you. If you have any questions, you can visit our website at realtalkmedicare.com. And this is one of many checklists that we have. We have charts that compare what plans cover what benefits, what percentage is covered on Plan F, Plan G, Plan N, what's not covered at all on any plan. What are the top 10 plans? What states are they in? What plans do they offer? What's the difference between Medicare Original, Medicare Advantage, Medicare Supplement? Just all that stuff. We try to make it as simple as possible in one place so anyone can understand it. I didn't have a resource like this when my mom and I would go through her Medicare stuff. And it was frustrating and maddening, and we both dreaded it. But it's so much easier, and this will make it easier for you too. Thank you so much. Let me know if you have any questions. Take care. Bye bye.